Hi there, how are you doing? I'm happy for you. I know all is well, and I'm excited for today's session. It's a very nice topic. It's about peptic ulcers. I know many people around me and around you, wherever you are, have had issues to do with ulcers. And they will tell you, I'm not able to eat this and I can't eat this because of ulcer. And it is becoming a challenge to their dietary intake and consequently their nutritional status. So let us today learn something about peptic ulcers. What can we do when we have someone that is suffering from it? And what can we do to prevent the occurrence of peptic ulcers from those that are healthy? So I hope you enjoyed this session. I look forward to getting comments from you, responses, or even inquiries over the same. Walk with me through this journey. Welcome. So what is this disease that we are calling peptic ulcers? And I'm drawing my discussion from research by Anand 2021. Peptic ulcers in a layman's language simply refers to the occurrence of sores or wounds along the inner lining of the stomach or the small intestines. And this eventually makes the digestive juices to come into contact with the tissues of the stomach or the tissues of the small intestine. And some of these digestive juices contain hydrochloric acid, which is very concentrated, and also pepsin enzyme. So this acid now causes corrosion on those tissues, on those cells, and you will feel now pain because of that lack of the protective barrier that would have otherwise prevented these digestive juices from coming in contact with the tissues of the stomach or the duodenum. If the ulcers is occurring in the stomach, it's called gastric ulcers. And when it is occurring in the small intestine, it's called duodenal ulcers. And sometimes the pain can go even upper side towards the esophagus. So, what are some of the causes of peptic ulcers? The number one cause of peptic ulcer is a bacteria called Helicobacter pylori. This is a bacteria that when one is infected with it, it colonizes the stomach or the small intestine. It corrodes the inner lining of the small intestine and the stomach, resulting into inflammation or pain. Number two, there are types of drugs that are called non-steroidal anti-inflammatory drugs such as aspirin, among others. These drugs also contain chemicals that when taken in excess amount or over a long period of time, they make the inner lining of the stomach or the intestine to wear out, and that now exposes the tissues to the gastric juices. And then also number three, alcohol. Concentrated alcohol has been associated as number one risk factor. When you take concentrated alcohol over a long period of time, it also results into wearing down of that inner lining. And also it inhibits or impairs the recovery process for someone who is already suffering from peptic ulcers. Some of the signs and symptoms of peptic ulcers include, number one, there is a burning pain between the navel and the breastbone. You will hear that person complaining of pain between the navel and the breastbone. Number two, there is vomiting or nausea. The patient feels nauseated even after eating, they want to throw up. And also they also complain of back pain at times. And there is loss of appetite, which eventually leads into weight loss. Some of them will even say they're feeling a particular pain that when they just take antacid, they feel well. That is just to show that that drug is an antacid. It helps to neutralize the excess acid that has gotten into the stomach or into the small intestine as a result of these digestive juices getting into contact with the tissues or cells of the stomach. So, what are the complications of ulcers? Ladies and gentlemen, I would like you to know that ulcers is a very serious disease, and when left unattended to, it can result into more complications. Like it can cause bleeding, because we have already said the inner lining has broken. So and the tissues are already being attacked by these digestive juices, so it can result into bleeding. Number 2, it can also cause gastric outlet obstruction. That is, the passageway between the stomach and the small intestine can be blocked. And number 3, it can lead to proliferation. That is, an opening or a hole through the stomach. And these things are unhealthy. They may need more medical attention, or they could even cause death. So, who is at risk of getting peptic ulcers? Number 1, anybody who is infected by Helicobacter pylori, which we have said is the bacteria that causes peptic ulcers. Such a person is at a risk of getting peptic ulcers disease. Number 2, a person who uses alcohol, concentrated alcohol, over a long period of time is also making the inner lining of the small intestine to get weak over and over, and that could be a bigger risk for getting peptic ulcers disease. Number 3, if someone is on drugs that we are calling non-steroidal anti-inflammatory drugs, such as aspirin, over a long period of time, such also drugs makes the inner lining to wear out due to their chemical composition. And lastly, if someone is having a family history of ulcers, there are chances that they could also get peptic ulcers. What is the nutrition management or nutrition care for peptic ulcers disease? Number 1, we need to know that when someone is suffering from peptic ulcers, they should avoid foods that would irritate the stomach or the small intestines. These are foods, for example, which are spiced, foods which are fatty. Such things would irritate the stomach or the small intestine. So such a patient should avoid those kind of foods. Number 2, the person should eat small frequent meals about 6 times in a day rather than 3 large meals. As a healthy person would just eat breakfast, lunch, and supper, 3 large meals. But someone with peptic ulcers, they would rather eat small frequent meals, totaling to about 6 meals in a day. Number 3, this person should avoid foods that are acidic. For example, citrus fruits. Such things would even increase the pH to be more acidic, because we are trying to avoid the acidity. So such a person should avoid foods that are acidic. Another important point is that this person should eat a bland diet. When we say a bland diet, we mean the food should be chemically bland. Chemically bland refers to it doesn't have chemical spices, things that will irritate the stomach or the small intestine. Then mechanically bland. This is food that it is soft, so that there will be no much strain to digest this kind of food. So it should be cooked well to ensure it is mechanically bland. In other words, it is soft. And then number 3, it should be thermally bland. When we say thermally bland, we mean that this food is not too hot or it is not too cold. So thermally bland, chemically bland, mechanically bland. This person also should avoid or limit the intake of carbonated drinks and also alcohol. And this person is encouraged to take vegetables and fruits that are well cooked, that are soft and well chopped, and also those that are not acidic. So, which foods are recommended for someone with peptic ulcers disease? Number 1, milk and milk beverages. Milk is highly recommended because the proteins in it have a buffering effect. In other words, they cause balancing of the pH in the stomach and in the small intestine, thus preventing it from being acidic, too acidic. Another food that is recommended is bread and rice. They are also recommended. Someone with ulcer can still take bread, can still take rice, can even still take posho. Someone with ulcer can also take chicken, they can take meat, they can take fish, as long as it is not spiced and it's not cooked with a lot of fats, and that it is also soft so that digestion can be easy. Fruits and vegetables are also recommended. Just make sure that they are not acidic. Like I gave you an example of citrus fruit. Just make sure they are not acidic And also make sure for the case of vegetable, they are well cooked so that they are soft, to avoid that mechanical straining during digestion. And which foods are not recommended? The foods that are not recommended for someone with peptic ulcers, number one is carbonated drinks. Also, tea and coffee, strong tea and coffee, they are not recommended. Alcohol also is not good because we have said it increases the wearing of the intestinal lining, that protective barrier. Another take-home message is that foods that are spiced, foods that are fatty, they are also not recommended. Foods that are smoked, they are not recommended for someone with peptic ulcers disease. It is important, ladies and gentlemen, that we observe this diet very keenly, because in as much as it looks simple, but wait until the person is in pain, then you realize it is not a simple thing. But we can avoid it by being careful with what we are eating, alongside other medications that have been prescribed by the doctor. So that is it for today, ladies and gentlemen. Please, thank you for listening. Thank you for finding time to tune in to today's lesson. And I request you to share this message with so many people, because many people are suffering from peptic ulcers and they get a lot of information, some of it which is not true. But as you have seen, my content is research based and it is coming from latest research. So it is worth sharing, adopting and following for better and healthy lifestyle of ourselves and those that we care for. Till next time, have a good time. Bye.